All right, so my name's Jenny Salisbury. I'm the executive director of HealthLink Dental Clinic. We are a full-service dental clinic located in Hatboro, Pennsylvania, but we serve both Bucks and Montgomery counties. So today I'm going to highlight our model of care, share some of our innovative approaches that we've taken to reduce barriers, and showcase the partnerships that have made our impact possible. So we operate as a free dental clinic dedicated to adults. This says ages 18 to 64. That's not technically true, and I wish I'd taken it out, except for it reminded me to say that initially we had said 64 because one of our requirements is that people must be employed in some capacity, and our board figured that between Medicare and retirement, over the age of 64 probably wouldn't qualify for our services any longer. That has changed quite significantly. One, because not all Medicare plans have dental unless you're going to Medicare C, which not most of our patients can't afford. And a lot of people can't afford to retire anymore, so they're still working after 64. Some of our other eligibility criterias are that they must live in either Bucks or Montgomery County. They may not have dental insurance. I did mention that they have to be employed in some capacity. It does not mean full-time. It could be part-time. It could be seasonal. You could walk your neighbor's dog and have them write me a note that says that they pay you $10 a week to do it, and I will accept that as employment. And they can earn no more than 250% of the federal poverty guidelines. Our largest age bracket of individuals that we serve are 31 to 45 years old. About 40% of our patients fall into that age bracket. The largest bracket of income, our patients fall between 100 and 150% of the federal poverty guidelines. And then 64% of our patients are Spanish speaking. We cover a combined square mileage of 1,109 square miles. So our services are comprehensive. We provide exams, cleanings, x-rays, fillings, extractions, root canals, and crowns. Everything is free, so if you qualify to be a patient, you pay for nothing. Our operating budget is a little over $400,000 a year, and so I have to go out and raise the money to do that. Last year, we saw 939 unique patients. 168 of them were new. We did 1,361 appointments and 2,267 procedures. The value of services we provided last year was around $441,000. And a key part of our model is that we are a true dental home. So we are a standalone clinic, and we do everything in our office. So our goal is to get our patients to come to us for everything. So they haven't had access to routine care in years for the most part. We focus on long-term relationships and ongoing preventative care, not just emergency treatment. So we really are encouraging our patients to come in for their cleanings and not just call us when they are in pain. So connecting oral health to overall health is also a big part of our model. We understand that a good majority of our patients don't go to see a primary care physician. And so even though we are solely a dental clinic, we really try to show them the connection between their oral health and other aspects of their health. All of our patients receive blood pressure screenings, and we do A1C testing for them so that we can monitor where their blood sugars are, that kind of 3-month average. There have been a handful of patients that, because of A1C testing and then noticing other things about their oral health, we have referred them to a primary care physician, and they have found out that they had type 2 diabetes, which they would not have known. We also do tobacco cessation education. For our patients who are pregnant or may become pregnant, we spend a lot of time explaining to them the real connection between oral health and pregnancy outcomes, because many have never been told about that before. I'm actually in the process of trying to develop a program specifically for expectant mothers to work with OBGYNs to try to refer their patients to us that might not have dental coverage. My biggest barrier to this is I don't have enough volunteer dentists because, we have a very small window of time to get somebody that's expecting in for their dental care, so I have to be able to prioritize them and push them up to the top of the list to come in as a new patient. So my biggest hurdle right there is getting some more volunteer dentists in. So when we do identify our issues, we refer our patients to different medical partners around the 2 counties that we serve, so that our care is integrated and not siloed. So some innovative approaches to make sure that we are ensuring access to people that might otherwise not have it. We've had to become creative. So we have an academic partnership with 2 different dental hygiene programs, Montgomery County Community College and Manor College. Hygiene students use our site as a clinical rotation site. So they come through HealthLink and they're either supervised by our volunteer dentist or their faculty advisor. And it really does increase our capacity of being able to do preventative care for our patients. We currently on staff, we have 1 part-time dental hygienist. She works 5 hours a week. And other than her, it's the students, and that's all the hygiene I can do out of my clinic. So those student partnerships, those university partnerships are really important. We do trauma-informed scheduling, so we allow a lot of extra time for appointments, even if they don't need them. So for those hygienists that don't like those 30-minute appointments, we give you an hour. But it gives us time to connect with our patients and really kind of create a relationship, because the only way that they're going to come back for their preventative care too is if they feel comfortable and they like coming to the clinic. They will come back if they are in pain, but if they are not in pain and they don't have a connection to us, they're not going to come back. And we see a lot of dental anxiety, particularly because our patients have not had access to dental care for so long. I did mention that over 60% of our patients are Spanish speaking, so we do have a staff member, my clinic manager is bilingual, and all of our materials and applications are in Spanish as well as English. I'm in the process of trying to figure out what other languages we might need to translate those into. We do training. Yesterday, I was really excited to see the presentation on screening for intimate partner violence. So all of my staff and volunteers go through a training on that. I come from a background, I worked my first 8 years in the nonprofit arena at a domestic violence organization, so I understand how important that is. But just making sure that my staff and volunteers are prepared and have the information in the event that somebody does disclose. We have digital access for our patients. They can do their applications online. My volunteers can fill out applications online. And we are getting ready to, I'm really hoping, launch a pilot program for dentures and partials. That's not been something that we have done in the past, but my least favorite part of my job is taking somebody's teeth and not giving them back. And so we are trying to get ready to launch that in the new year. It focuses not only on oral health, but on dignity, confidence, and employability. Truly, my dream for my patients is that someday they won't be qualified to get care from me anymore. And so in order to break that cycle of poverty, they have to have teeth. It's very hard to get a forward-facing job that pays a living wage if you're not confident with your smile. It's the first thing that people see. Community partnerships are super important to us. So we work with a lot of veterans organizations to connect former service members, particularly because only 15% of U.S. military veterans qualify for comprehensive dental care through their VA benefits. We have a lot of corporate and foundation support. I mentioned that $400,000 has to be raised every year in order to run our clinic. We're very lucky to have foundation support from United Concordia, Delta Dental, Independence Blue Cross, and about 25 other funders. Then we also have individual funders that help us. Our local and state leaders we work really closely with to advocate for our clinic. We were able to receive funding from the state a couple years ago for the first time because of our partnership with a couple of state representatives, and that has been hugely helpful. And then work with coalitions like PCOH really help us to be able to amplify our message. Collaboration within the community is important, so we work with a lot of hospitals and other community benefit organizations that serve similar populations to us. Our volunteers and our donors help to spread the word about us because, quite frankly, people come to us more from word of mouth than if they saw a flyer about us. We are partnering with an organization called United for ALICE this year. ALICE is an acronym that stands for Asset Limited, Income Constrained, Employed, which truly defines my entire patient base. They are releasing a report on the dental divide nationwide come January, and HealthLink has partnered with them on this, which has been really exciting and interesting. So it highlights the challenges faced by working adults who are earning but still struggling to afford even basic dental services. So just a couple things that we've learned, because I'm sure I'm out of time. Yep. So relationships really matter. Relationships with our patients, relationships with my volunteers, relationships with our community members that support us. It's all about trust. Flexibility is key. So we've kind of constantly had to adjust our model to make sure that we're meeting our patients where they need to be met instead of asking them to kind of change where they are and what they need. Data is the only way that we can tell our story, and being able to show our impact has been hugely helpful. And truly, kindness heals. I can't tell you how many of our patients come in and they are very, very nervous. And then once they sit down with my clinic manager, once they sit down with our volunteer dentists, who all of my volunteer dentists are lovely. A couple a little rough around the edges, but they warm up. But I cannot tell you how many of our patients thank us for listening, thank us for being kind to them because they were really scared. A lot of our patients come back and they'll bring us food, lots of baked goods. We had one that came back and built office chairs for us. That took something off my plate, so that was very nice. But, just truly we're giving them back their smiles, and that's really important. Looking ahead for us, despite ongoing challenges, which, we've made some headway with that, the budget impasse. So that's good. So hopefully some things will move a little bit quickly in regards to funding for that. But we are seeing a rising demand for free care. We're going to launch our partials and dentures pilot. I want to expand volunteer recruitment. I cannot say it enough. I need more dentists. So if anybody knows anybody in Bucks or Montgomery County that might want to volunteer, let me know. Continue to strengthen our collaborations, look at alternate sources of revenue, because we don't want to get stuck not being able to provide services because one purse gets held up. And then continuing to advocate for oral health. And small clinics can make a big impact is really kind of the biggest lesson that I've learned working in this dental field for the last 5 years. And access to dental care isn't just about teeth. It's about, dignity, confidence, opportunity. So that's my information. I love to collaborate with people, so please reach out if you have suggestions, if you have ideas, if you just want to chit-chat. I'm your girl. Thank you.